Hello, everybody. I am so glad to have you here to talk about how to chart. I wish that we could be spending this time together in person, but I'm grateful to have the opportunity to use technology in a way that benefits us. So glad that you could be here. So, my name is Jessica Reeves, and we're going to talk today about how to chart. And warning, spoiler, it's more than writing a SOAP note, although writing a SOAP note is a really big part of it. So, a little bit about me. My name is Jessica Reeves, as I said before, and I'm a nurse practitioner, and I also coach nurse practitioners. I have been a nurse practitioner for about 7 years, a nurse for over 10, and I've worked mostly in family medicine, reproductive health. That's where most of what I've learned about charting and how to get more out of it comes from. And I realized that although, being a nurse practitioner is maybe my superpower, maybe similar to yours, my real passion is time management. And it goes back actually pretty far. When I was 8 years old, I got a watch really, really similar to this. Some of you may recognize it. The only difference with mine was that the part that you see that's blue was white. And what this is actually a watch and a wallet. This was the 80s, so things were a little bit different then. And this was a watch and a wallet combined. I took the watch out. I think I threw the wallet away, but I started wearing a watch. I was about 8 years old. And I became really pretty obsessed because now I had this watch. I had it with me everywhere. I was able to really pay a lot of attention and track how long it took to do things. And that included things that I wanted to do, but it also included a lot of things I didn't want to do. And I saw how long it was taking to do my chores, like clearing the dinner table, that sort of thing. And I was on my journey to find ways to make those things that I didn't like doing, clearing the dinner table, charting, go a little faster. And to find those efficiencies and find the ways that I could make these things that were really unavoidable either a little easier to take or over a little bit more quickly. So those lessons started for me when I was really young, and they followed me into clinical practice. And one day I was working in a busy family medicine practice. I think every family medicine practice is pretty busy. And I had a no-show. And the charting system that we had in our practice had some reporting features. And so I was sort of clicking around to see what kind of reports were available to me. And there was one that showed how often you were closing your visits the same day. And it tracked the previous 4 quarters. So I was like, oh, great, what's this? And I ran the report and I saw that I was actually closing between 96 and 97 to 100% of my visits the same day for the previous 4 quarters with one little blip, and that was at the beginning of COVID. And I knew I was doing all right, but I was doing better than I thought I was. And people had been kind of picking my brain and asking me, how is it that you're always closing your charts the same day at the same time that you are leaving on time consistently? So I decided to kind of put my thoughts together, and I thought that I might have enough to write an article. I ended up having enough to write a book, and I kind of, once I started writing, I didn't stop. So my book is Secrets from the World's Most Productive Nurse Practitioner. I've also been featured in Doximity, Real World MP, KevinMD.com, and some others. So the long story short is I love talking about this stuff. I love helping other clinicians. My favorites are nurse practitioners, of course, but I've worked with, veterinarians, I've worked with dentists. I love helping us to tackle these things that we aren't really taught and that unites us all. That's my big motto, I guess, is that charting unites us all. No one is really taught how to do it. If you have actually been taught how to do it in school, then you are in the minority. You are in rarefied air. And yet it's something that we all have to do. We all struggle with it to one extent or another. No one taught us how. And so we're all sort of out here on our own, sort of flopping around, right? Like a fish out of water. So today we're going to talk about how to chart and how whatever you're doing now, if you want to make it a little bit better, we can get you there. If you want to make it a lot bit better, we can probably get you there too, not all at once. But I want to set a little bit of ground rules. I love to have my expectations managed. So I'm going to assume that you feel the same way. And I want to let you know, today is not about hacks. Today is not about shortcuts, although you'll notice there's an asterisk in there. Today's really about philosophy. We will have some hacks. There will be some literal tips, do this, try this, that sort of thing. We will have that definitely. But what's more important, the reason why I want to talk to you about the philosophy and the approach to charting is because it doesn't matter where you work, whether you work for a private practice or you work for a huge healthcare system. It doesn't matter if you work in primary care, if you work with pediatrics, if you work with urgent care. It doesn't matter if you see 5 patients a day or 50 patients a day. What I want to talk about today and the things that I want you to think about as a result of today are things that are going to help you uncover the tools, because they're in you already, right? They're going to help you uncover the tools that you can take with you everywhere. So if you decide to go work for a different kind of practice, if you're working for a big system and you decide to go work for a private practice, if you are working at a place you want to stay where you're working for the next 10 years, but they decide to change their charting system and you were really good at charting system A and now they decided to change their charting system B, and that seems like it's going to throw a wrench in the works. It will for a minute, but you are going to have the tools. You're going to recognize the tools that you have and how to get more of them that will follow you no matter where you work. So if you switch to a specialty practice, you're going to be okay, right? So hacks can be situation specific, right? They can help you get through the day in primary care or whatever, whatever your clinical setting is, or we can get you better at using charting system A. But then if that changes, a lot of those hacks go away. I think that the philosophy and the way that you approach things like charting, when you really look at that and you really drill down to that, then you're able to get higher yield and more sustainable insights and then strategies, right? And techniques that are going to follow you. So now that that's out of the way, let's talk about what actually is charting. What is charting? So I said at the beginning, it's not just writing the SOAP note, although it is writing the SOAP note. That's a huge part, right? The note that documents your encounter is the second biggest thing that you're going to do in your clinical practice. The biggest thing is going to be seeing patients. So all day long, right, you're bouncing between visit, note, visit, note. But everything else that you do that is not directly patient related, that does not involve the patient being in the room face to face with you on some level, that's charting. So that means the note, but it also means if you've ever either worked in hospitality or know anyone who has, or you're familiar with any of the terminology, they call it side work. So you may be a server and you may be taking customers' orders and bringing them their meals, their drinks, that sort of thing. But there's all this side work that you have to do that is part of the job, but it's that sort of below the waterline. It's the stuff that people don't talk about. So rolling up silverware, refilling salt shakers, right? Charting is like side work in healthcare. It's all of these other things that aren't specific, but they're specific to the patient, but the patient doesn't need to be there. So that is writing the note from your encounter, but it's also putting referrals out. All the work that goes along with that, receiving referrals if you work in a specialty setting and making sure that you have everything you need in order to start taking care of this new patient. It is placing orders for medications, for durable medical equipment, for labs and imaging. It is resulting those labs and the imaging that you get. It's not that involved of a process to place an order for a CMP. But once you get those results and you have to look through and see, this is normal. Did I expect it to be normal? It's abnormal. Did I expect that? What are the particulars of this patient? Why did I even order this? Everything that goes along with that, that's part of charting. That's part of that side work, and it takes time. Patient messages, another big part of charting. It seems like it's getting bigger every day. Responding to patient messages can take up a pretty significant amount of your time. Responding to staff messages can also. And I would even throw into that email messages, right? So that's a non-clinical piece, but that's all stuff that relates to your job, and it's all part of that side work, and I would call that charting too. If you are finding out about needing to fill out some paperwork for HR, or maybe there's a lunch and learn that you need to go to, or a reminder of a staff meeting, all of those sorts of things are things that you need to tend to that take time that aren't necessarily accounted for in your schedule, and that's all part of charting also. Another big piece that refers to notes, but it's other people's notes, would be what I would say is the new patient, right? So you've got a new patient coming in, especially if you work in like primary care or family medicine, you can have a stack of paper coming in with that patient. It may come in electronic form, but it's still still a lot, right? And you need to look at that. You need to, maybe you have a patient who is in their 70s who's relocating to your area. They want to be closer to their kids and their grandkids, so they've moved and they're establishing care with you. Great. Maybe they've been up to date with all of the care that they need, and so there's a lot to review. On the flip side, maybe they haven't been great about staying up to date with care, and you need to go through all of that and find the gaps and see where they stand with vaccination, see where they stand with their routine screening, see where they stand with care in general. Do they need refills? Are there diagnoses that just haven't been made, right? You hit a certain age, you're probably going to have at least a couple diagnoses. So looking through that, that's time, and that's charting. And that's something that we have to kind of shoehorn into our day in a lot of cases. And, even sending a referral out when that person comes back, if you work in primary care and you send them out to physical therapy, at the end of that, maybe 6 weeks of physical therapy, you're probably going to get a note from physical therapy that's going to talk about what they did and what kind of outcomes they got. And then you're going to see that patient for follow-up, and you're going to need to be prepared. You are going to need to be prepared when you see the patient that just got discharged from the hospital or was seen in the emergency department over the weekend, and now they need to follow up with you. All of that is part of charting as well. So it's not just sitting in the room with the patient, and it's not just writing the note to document having sat in the room with the patient, but it's all of this other stuff that really can take a significant toll on our day. And it's challenging, right? And there's a couple of different reasons why it is so challenging. I chose this picture because, we've got sort of a classroom setting, and then up on the board, there's nothing, right? If that looks like how you were trained to chart, then you are not alone, right? In school, we don't really learn this. If you're lucky, you might have a preceptor who gives you some tips, some tricks, lets you watch their workflow, maybe answers questions about that. That is something that we can't really count on, but it's great when it does happen. Probably even more rare are the people who have any kind of specific training about that workflow that goes along with charting when you're in school, because we really don't get it. So we find out, how did you learn? I learned on the job. I learned from trial and error. I learned what not to do, either something that I did that then I learned don't do that because it takes too much time, or you're going to get called out for coding that wrong or not going into enough detail. You kind of learn what not to do on the job. Or you see your colleagues, maybe you share an office with someone, and you see that they are really struggling. They are charting until 10 o'clock at night. Not uncommon. I've definitely seen that. That's kind of what not to do. But in terms of what we do, that part is kind of left up to us. So it tends to be something that we learn through trial and error, and kind of the hard way. And when you're already new in your role as a nurse practitioner, and then you add this on top of it, it's really, really challenging. And to get a handle on that, and then to improve on that wherever you start, whatever your baseline is tough. But we can talk about some strategies, some philosophies that are going to help you to understand a little bit better and understand what you've already got within you that you can harness, right, to make things better. But I want to talk about a couple of things that definitely stand in the way and why charting is so challenging. One of the first things is perfectionism, right? When you are trying to get an A+ on everything, it's admirable. It's admirable to want to do a good job. I know that I want any clinician who's taking care of me to do their best, but I don't want them to overdo it either. I think that it's a fine line. And when we're looking at how we're taking care of our patients, when there's perfectionism, writing that perfect note is one of the ways that it can show up, trying to do the perfect visit note. And it can turn into a lengthy a lengthy thing. When you're in school, you may have learned how to do a SOAP note to really kind of pick apart a sample patient, right? And at the graduate level, when you're getting a master's or a doctorate and you do that SOAP note, I know that these can stretch into like 7 or 8 pages for an assignment. And that's just for one healthcare condition, right? Hypertension. The point of it is to point out that you're able to understand the pathophysiology of whatever the case may be, hypertension, for example, and that you understand what the differentials are that you need to rule in, rule out, that you understand what your pharmacological options are and why you may choose the ACE inhibitor, you may choose the beta blocker, or you may choose a diuretic. And so that you're kind of pointing that out. And then you're also pointing out that you understand the academic resources, right, for all of those. So a lot of citations. You're not going to do that in practice, right? So it's hard when that's the good feedback that you've had in school, is do this lengthy note that is going to turn into 7 or 8 pages for just one concern. And then maybe you get an A on it. That's great. Or your professor says, job well done. And so you keep doing that. And it's hard to turn that off. It's hard to know where you can pull back on that. Sometimes it's hard to even realize you're doing it. But when you're trying to write the perfect note, which doesn't exist, right? You'll never have that absolutely perfect note. Or when you're trying to get everything done completely correctly. Not that I don't want you to do things correctly, but at what expense, right? Do you need to go into great depth with the note? Not necessarily. Do you need to respond to every staff message the minute you get it, or can it wait until you get back to your office? Those are examples of perfectionism. Do you need to chart in the visit, in the exam room with the patient? Not if it's making it more difficult to do your job. So perfectionism is something that gets in the way of us being effective with our charting. You can, at the end, I'll give you my email address. I have a perfectionism self-assessment that can help you know. If you want it, I'll send you a copy. That can help you know if perfectionism might be showing up for you, but it's very, very common. It's very, very common with women. It's very, very common with clinicians. So nurse practitioners sometimes can really be caught in the crosshairs of perfectionism. Another thing that gets in the way of us being effective with our time management and being effective with our charting is imposter syndrome. And if you're not familiar, I'll give you the quick version. Imposter syndrome is this generally mistaken belief that that subjective belief that you are flawed, right? That it is a fluke that I made it this far. It is a fluke that they granted me my degree. I have no idea why they did that. It's a fluke that I passed my boards. The computer must have been broken and didn't record all my wrong answers somehow. And so I don't know how this happened, but I am just going to go with it, right? I don't want to get found out. If I believe I'm an imposter, then you don't want to tell anybody that, because you really think that you are not valid, even though you are, even though you know better, that nobody gave you your license. You had to earn that. And you didn't earn it with one act. You earned it with years of training and preparation, improving your education, improving that you know what you're talking about. But still, it's hard to pull out of that. And I'll tell you, it's actually super common. If you have never experienced any form of imposter syndrome, then you have worked with or studied with or maybe lived with or been friends with somebody else who has. It's so common, and it's more common actually among high achieving people across disciplines. So not specific to even healthcare, but tech, finance, anybody, right? Education, anyone who is a high achiever is likely to be at risk for imposter syndrome. And the tricky part with that is that when you're feeling that way and there's a part of you that keeps saying, no, you're a fraud, you don't deserve this, you didn't earn this, that's not something that you're going to want to share with other people. You're going to try to deal with it on your own. If you're an imposter, if you have imposter syndrome, you probably have some perfectionism showing up too, right? And when those two go together, they feed each other. And the imposter syndrome can make that perfectionism worse. And the perfectionism can make the imposter syndrome feel a little more sharp. And you don't want to tell anybody because you're afraid of getting found out. So why would you share that with anyone? That's actually the cure for imposter syndrome, is a reality check. To talk with somebody who knows your work and is able to tell you where you could be better and where you're doing just fine. But it's hard to reach out for that. And that shows up in overdoing the work that we do. And that definitely shows up with our charting. and the amount of time and impact that that has. The third one, and these three all kind of feed each other, is comparison. I call it sometimes the comparison trap. And in a social media sense, sometimes they call it fear of missing out. It's the same idea. And this is something that I see for a lot of nurse practitioners. And I know for myself, it started in school. It actually goes all the way back for me to like nursing school, where you finish the test. And like the minute you were done with the test, back in my day, we did pen and paper tests. The minute you put the pen down, and you go out into the hallway, you turn the test and you go out in the hallway, and everybody says, because I was never the first one done with the test, what did you put for number 5? How did you do on the test? All that sort of thing. It's comparison, right? And then when the test results, when your scores are available, what did you get on the test? How did you do, right? And it's hard to avoid that, and it's hard to reckon with that. And then once you start getting exposed to that, and it grows and it grows, and it follows us into practice. And we see our colleague who is leaving every day on time, maybe with a smile on their face, maybe not, but we just maybe assume, oh, they've got it all together. Right? They are done. They're breezing out of here at 5:05. Good for them. Boy, am I jealous. You don't know. You don't know if all their stuff is done. You don't know if they're going home, bringing their laptop home and charting until 11 o'clock at night. You don't know, right? So when there's the perfectionism, when there's the imposter syndrome, when there's comparison, when those three get together, which is very common, they tend to feed each other and they tend to hold us back. And because we don't talk about that, that holds us back even further. And that can impact our charting. That can impact our effectiveness with our time management and our ability to get the job literally done, right, in a reasonable amount of time. So I want to talk about 3 things that we can do about it. So we kind of talked about what it is and sort of where some of this comes from, right? We're not taught. And then we've got some things that kind of come along with the culture of becoming a nurse practitioner, maybe in school or just in the United States, that impact us, right? So now let's talk about what we can do. What are the tactics that we can kind of throw at this so that we can shift things back into our favor, right? Instead of it benefiting, all these things benefiting everybody else, because your patients definitely benefit from you being a perfectionist, but your family doesn't. Your employer might benefit from you comparing yourself to other people, but do your personal relationships? Probably not. So let's talk about the things we can do to kind of get things back in balance, right? So that they don't look so much like this, but let's get things back in balance. So you'll see there's a little asterisk because we've got some actual practical tips in addition to philosophical pieces that go along with this. So the first thing that we need to do is we need to understand. We need to understand ourselves, right? And we need to understand how we work and how we want to work, right? So there's a bunch of different ways we'll talk about that, how we can do that. But if you don't understand, this is like getting your baseline assessment, right? If you don't understand where you are, then anything that you throw at it isn't really going to stick. You might get lucky. You might get pieces of it that stick, but you're not going to get that lasting, sustained improvement, which is really what you want. So first we have to understand. Second, we need to identify. We need to find out what's actually in our control. If part of the issue is that we hate the charting system that we're using, right? And there are some out there that are not as easy to use as others. I'm not going to name names, but everybody has preferences and there's no perfect system either, right? So there's always something that could be improved. But if you really hate your charting system and the software that you use, that's probably not in your control. Your best bet is going to be to learn how to work with it, but you're not going to be able to change what you're using. Are there other ways, though, that we can fix the things that are in our control and address the things that are in our control to make things more beneficial or skewed a little more toward us and what we need? And the third thing is to ask for help. This is a tough one. This is really, really tough. When you're feeling those feelings of perfectionism, comparison, imposter syndrome, or anything resembling them, it's hard to raise your hand and to ask for help. But there are some ways that you can do it that are a little bit easier and don't feel like asking for help. So I recommend them. So let's talk about them, all right? So When I'm talking about understanding, there's two things that I want you to think about, and one that you can start doing tomorrow or the next day that you're in clinic. And it's a time audit. Okay. Again, at the end, you'll have my email address. If you'd like a sample, I can give you, I have a sample worksheet that I use with people. But you don't need anything fancy. You can just use a blank piece of paper. But a time audit is going to be like if you were, your time is like a budget, right? So if you were trying to understand where all your money is going, you might, for a period of time, a week or a month, write down everything that you spend money on and keep track of it, right? And then at the end of that week or that month or whatever that period of time is, you're going to look back and see, where did my money go and where do I want to make changes? Your time is the same. It really is the same. So I start with a time audit. I really recommend that you do it for a good solid work week, whatever that means for you. So if you work in like urgent care and you only work 3 days a week, but it's 3/12s, do it for that. If you work in a pediatric office and so you're working kind of a 9 to 5, 5 days a week, do that. The minimum is really one day. I really, really encourage you to do a full week though, because you're going to get more out of it. But do the best you can, right? That's the most important thing. And just do something. That's the most important thing. So doing a time audit, you're going to write down everything that you do during your work day. Now, if you're scheduled, I'm going to say 9 to 5. No one works 9 to 5, but if you're scheduled from 9 to 5 and you see patients from 9 to 5, then maybe you write down, don't put any protected health information, but from 9 to 10:30, saw 5 patients, or saw 10 patients, whatever it is. If you had one patient that was a real outlier for any sort of reason, maybe they were more complex, or more acute, or they were a new patient that came in with like 19 different things that they want to talk about, which does happen, that would be something worth noting. But don't put like their name or anything like that. No HIPAA sensitive information. This is for you anyway, right? So you're going to put down everything that you do. So 9 to 10:30, saw 5 patients. 10:30 to 11, what did you do, right? I would track it by half-hour increments as much as you can. Maybe from 10:30 to 11, you saw a patient and you called another patient. You returned a phone call, or you returned a message, or you resulted 5 labs, whatever it is. Then at the end of that period of time, I would recommend that you take and write this down on paper. Don't use a spreadsheet. You might be tempted to write it on paper and then take it someplace where you can have privacy for at least 30 minutes. So if you can do that at home, great. If you need to go to like a coffee shop and get a cup of coffee where you can be left alone for 30 to 60 minutes and just focus on what you have on your audit. What can you learn from this? And where's your time going? Are you spending a lot of time on patient visits? Are you planning to work from 9 to 5 and you're done seeing patients at 5, but it's another 2 hours before you're done with all of your charting? That's important to know. From there, you can develop your time budget. Okay. So when you've got the audit, you know where your money or where your money or your time, where your time went. Then you can take it into a budget and you can make a goal for where you want it to go. So you may want to identify what your quick tasks are. What are things that I can do that are only going to take me seconds to minutes, right? I know that for me, resulting labs in most cases is a quick task, especially if it's a UTI, although you're going to do this usually in the visit. But, resulting labs for me is a quick thing. Reading imaging, no, that's going to take me more time to go through those and then to apply that back to the visit. So I give myself more time for that. But you'll find out what your quick tasks are, and then you'll have that knowledge that then you can deploy the next time that you have a no-show, right? And you have a 15-minute hole in your schedule. What can I fill that with that's going to be the highest yield for me? So understanding how you're using your time and how you want to use your time is big. That's a really big first step. It's an investment, but it's worth doing. The next thing is you want to identify. And there are 3 things that I want you to think about when you think about identifying. You want to identify what your boundaries are. I made a promise to myself when I was working as an NP in a family medicine practice that I would never take charting home ever. And I never did. And there were occasionally times that I needed to stay late to finish my charting, but I did not install the app on my phone. When I'm at work, I'm at work, and when I'm at home, I'm at home. That was my boundary. And I managed to stick with it. Okay. That was important to me. So I set that intention, I set that boundary, and I never breached it. I did sometimes need to stay late, but I never breached that boundary. And that was really important to me. Another task that I want you to think about in terms of identifying are opportunities to batch things. Okay. And what I mean by batching is we talked about all the different tasks that fall under this really broad umbrella of charting. There's a concept called task switching, and it's when you kind of bop back and forth between different tasks. So you might write a chart note, and then you might respond to a couple of patient messages, and then you respond to a staff message because you're in there, and then you place a couple of orders, and you're going back and forth, and they're really different and divergent tasks. When you do that, it takes time for your brain to switch. There's research on this that takes time for your brain to switch out of this task and into this task. And that wastes some of your time. That is not something that you want to do, right? So I batch things, and I think that you should do this too if you're not already. And what I mean by that is, especially once you have found out how you are using your time, now you can use that information to benefit yourself. So you can look at what your easiest tasks are if you want to get all of those done first. Or if you only have a certain amount of time, like you have a no-show in your schedule, so do 15 minutes worth of work. Well, I can get a lot of results done in 15 minutes. I might not get a lot of notes done, but I get a lot of results done. You can batch those things. So pick what you're going to do and pick the way that you want to go about doing it. Some schools of thought say do the hardest thing first, right? And then it's at least out of your way. Other schools of thought would say do a lot of a little thing, right? And then you've got momentum. It's really about your preference. And as you're learning about yourself and how you're using your time and how you want to use your time, you'll make the decision that's right for you. But with batching, you just pick a lane and you stick with it until you're done or until you're out of time. And that might mean that you do all of your notes until your notes are completely caught up, and then you work on other things. Or it may mean that you do all of your lab results until there are none left, or all of your patient messages, which can take a lot of time, until there are none left. And then you switch to the next task. So I think of it as like picking a lane. Go down that lane as far as you can until you run out of road. Then you can pick another lane and then do the same thing with that lane, right? So batching is going to help you to be more efficient because you are not engaging in that task switching. And depending on what your needs are and how you want to work, you can also get that feeling of momentum and accomplishment by picking the things that either suit your mood or just the way that you like to work and get those done first. So the difficult tasks out of the way first, or a lot of easy things out of the way first, that's fine. And then budgeting. We talked about budgeting your time. So knowing, because you've done that time audit and you can keep doing the time audit, that's completely fine. There's no limit on the number of times you can do it. It's just like any other, like it's like a quality improvement activity actually, right? But it's a personal use quality improvement. But once you've done that, now you have insight into the things that take you a long time to do. You should also get some insights on the things that are easier for you to do or quicker for you to do, or the things that you need to do when you know you're not going to be interrupted, you're not going to have distractions, or other things that you can do when it's very likely that you'll be distracted. You can then plug that in to your budget as you're thinking about how you want to use your time. So getting that understanding leads to that identification of strategies that you can use that don't matter about what setting you work in, or whether you work with old patients or young patients or really sick patients or pretty stable patients or chronically ill patients. None of that matters because it's about you. It's not about the setting. And then the third thing is asking, and this is hard. I know that this is hard. It's not, I can't say that it's easy for me, but it is something that does get easier the more you practice it. And one of the ways that you can ask for help is just simply enforcing your boundaries. Once you've identified the boundaries, which is easier to do once you've done that time audit and set your time budget, Once you've identified your boundaries, then you can enforce them. If you don't know what your boundaries are, I don't know how you would enforce them. There's a lot of different ways that you can go about doing this. It can be as simple as a do not disturb sign on your chair if you don't have an office door, on your office door. Things like that can be an easy way to, it's not going to guarantee that you won't get interrupted, but it may make your colleagues think twice about interrupting you if you're trying to chart. Another thing that I do that is pretty simple to do, and for me, pretty effective, is I use foam earplugs, the kind that you would use if you go to a show. I can still hear what's going on if there's a fire alarm or an emergency or someone really needs me. It's not like I can't hear anything, but it slows down what I'm hearing and it helps me to focus on what I'm doing. I have a hard time tuning out conversations if they're happening around me. So closing a door will help, but you can't always close the door. So having foam earplugs, you can get them on Amazon. I have like a big bottle of them you get for like $10. That's something that helps me to tune out conversations, but it also helps me to kind of get in the zone of now I'm charting or now I'm sitting down to do this task. Some people like to use earbuds, right? Or AirPods. I'm an Android person, so but headphones, right? So doing that, you don't even necessarily have to have music or a podcast or anything playing, but having those on sometimes is enough to send a signal to other people and to yourself. Maybe now is not the time to interrupt me, right? So those are ways that you can enforce boundaries. Reality checks are another thing that you can ask for. If you think that something like perfectionism or imposter syndrome might be part of what's getting in your way, if you have a trusted colleague, and that's an important part, having a trusted colleague, not your best friend who works at the bank, right? It has to be somebody who kind of understands what you're going through. Having a trusted colleague who can give you that reality check, I would ask for it to be, confidential. That's completely fine. But where am I doing okay? And where do you think that I could improve? Or what are the things that I could do a little bit differently? What do you recommend? Those are all things that are going to help you feel better about your job and the work that you do. And that's important because if you're not feeling it, all the other stuff doesn't matter, right? It's really hard to make the improvements if you don't really believe it. And getting a reality check will really help you with believing in the reality. Believing in the reality. There's a saying, and I like it because I think it's really applicable to a lot of the stuff we talk about. And so the saying goes, whether you believe you can or you believe you can't, you're right. And I think that really ties into everything that we're talking about. If you believe that you could get a little bit better with your charting, even 1% better, right? Not 50% better, not huge leaps and bounds, but even 1% better. Would 1% better be worth it? Well, it would be better than the alternative, which is no change, right? So if you believe that you can, then you will, right? Because you will then take the actions to make it happen. You will start to set the boundaries. You will start to look at what your budget is. You'll start to look at how you approach your tasks, where you approach them, when you approach them, how much time you want to spend on them. And you'll be able to make that happen. On the flip side, if you don't believe that the change is possible, it will never happen. Nobody's going to do it for you. It's up to you. Right? And yes, some charting systems are better than others. Yes, some workplaces are more supportive than others. That is absolutely true. All of these things exist on a spectrum. But the most important part of that spectrum is you. And what you do or don't do and how you go about that makes all the difference. Okay? But I don't want you to feel like this is completely your burden, right? So support. A mentor is great. I wish we had more residency options for nurse practitioners. There are coaches you can talk to, again, a trusted colleague. There are a lot of different ways. I think that the American Nurses Association has a mentorship program as well, for free, where you can be paired up with a mentor who can help you to get the support that you need, because it is the work we do is very, very difficult. And it's not just the heavy work that we do that's clinical, but it's all of the things that happen outside of the exam room that support that. It is very, very difficult, and it's hard to do it alone. If you are having a hard time, it is like exponentially harder to do it alone. So, getting the support that you need, whether that is having somebody that you can talk to, whether that is putting your foot down and saying, I'm never taking charting home, whether that is asking to not be disturbed when you're trying to do tasks that require your concentration, those are all ways to ask for the support that you need and to get the support you need. Another thing that goes along with this is admin time. That's a big one. I've never really had admin time myself, so I've always been envious of those who do. If you're not familiar, admin time is time that is held in your schedule on a regular basis, whether it's weekly or daily. It can vary quite a bit. But it's time that's held in your schedule between your 9 and 5, however that looks for you, that you do not have patients scheduled, and this is the time that you have to catch up on your charting. All of these things that happen outside of the exam room, prior auths, peer-to-peer reviews, doing orders, all this stuff, right? If you have admin time, all of the things that we talked about can help you to use that more effectively and to get more out of it. If you don't have admin time, you should ask for it. But it's hard to ask for things, right? So here is my pro tip for asking for admin time. The time audit that I recommend that you do can also be the objective evidence that you can present to leadership to say, I need some admin time, whether it is, an hour held out of my schedule each day. That's not a lunch break though. An actual hour besides a lunch break in your sort of 9 to 5 schedule. I've seen generous policies where people have like 8 hours in a week, which is great. But there's everything in between, and there's a lot of different ways to do it. If you are starting from zero, I would do the time audit and I would bring that to your leadership, whoever makes that decision, and show them, because you're showing that you've got the initiative to investigate the issue. You're showing objectively where things stand. And if you continue to do the time audit while you start having admin time, ideally you should be seeing some improvement, and those subsequent time audits will show that the admin time has been effective, right? And the more effective you are with charting, that's better for your workplace. That's better for them being able to get their bills out, for your provider satisfaction, for the other people who need to read your notes or get the responses to your messages. It's better all around. So if you're really, really struggling, asking for help can be tough, but there are some ways that we can go about it that can make it a little bit easier. I will leave you with this thought. It takes time, right? Change takes time. Get yours back. You are allowed to have work-life balance, work-life harmony, however you want to describe that. You are allowed to have that. You're entitled to have that. If you don't have it currently, it may take some work and it may take some time to get that back, but it can be done, and you are allowed. So you don't have to be a hero. There are ways that we can go about this that can help you to get that balance back for you. Okay. So I'm so grateful that we had this time together. And again, I wish that we could have been in person, but I encourage you to keep in touch. So normally this is where I would do the question and answer part, which is my absolute favorite part. Because we're doing this a little bit differently, I'm not able to answer your questions in the moment, but I absolutely encourage you. I've got my website here as well as my email address. If you'd like the time audit worksheet, if you'd like the perfectionism self-assessment worksheet, or if you have questions that you would have thrown at me in the question and answer period, shoot me an email. I would be delighted to hear from you and to help you to answer those questions or help you with any other tips and tricks that we might be able to come up with to get you where you want to be. Okay? Thanks so much for your time, and I look forward to hearing from you.